Hey everyone, it's DrRic. The tutorial for today is your first aid kit. This specifically applies to the folks that went to my fibromyalgia lecture back in the springtime. Well, it can be to everybody, really. The ideal for anyone, no matter what disease process you have, whether it's fibromyalgia, chronic regional pain syndrome, irritable bowel syndrome, even a cancer or a heart attack, the idea when you have a disease process, once you declare it, is you understand it. When you understand it, you should know what flares it up, how hard to push. Because any disease process, even the terminal ones, you still have to eat properly, you still have to move, and you still have to be in a social situation where you're interacting with others. If you have something like fibromyalgia, for example, and you just decide to throw the towel in, take the pain with pain medications, prescription or over the counter, and not move, the only thing that you're going to get is a side effect from the pain medicine. It'll certainly bring your pain level down, but it won't do anything for your trigger points. Your stiffness will cause more trigger points, and you'll need more pain medicine sooner or later. So I really like to have people move, eat, and interact, no matter what process they're going through. And sometimes if you know that you have that as your duty, then you know that you're going to need a first aid kit, because eventually you're going to have a little bit of a trigger flare up. So what I usually will do when I take folks to hiking excursions is I'll have the terrain studied, I'll know the speed and the injuries of the people that are going with me, and I'll have my first aid kits. Whether it's an injury kit that includes splinting and ace wraps for scrambling over rocks, or a cut kit and a blister kit for if we're going to be open water. The idea is I know the disease, or actually I know the trail, I know the environment, I know what to prepare for. I have my first aid kit. I can't take everything, but I have to have my select few things. For me, I'm a fibromyalgia sufferer. I like ice. My patients, some of my patients and fibromyalgia sufferers don't like ice. I think ice is great. I love having a Theracane. Theracane, I did a tutorial on this before, but Theracanes are excellent to have, especially for my trigger point, which is my left trapezius. Learned about this through a physical therapist. And then having a physical therapist is actually very important. Physical therapy, massage therapy, chiropractic, naturopath, osteopathic manipulation, all of them are important. But you have to find somebody that works with you, that you mesh with, and that is talented enough to take care of your flare-up or your trigger. Once you know somebody to rely on, then you can get to them in case you have a trigger flare-up, and you can cool your flare-up quickly. You can flare it down fast. So you know how to take care of it, or you will know how to take care of it as far as manual therapy. You should know what to use. Again, most of you know for the extreme flare-ups as far as problems with sleep, problems with depression, problems with pain. You get your pain medicine, you get your antidepressants, and you get your sleep medicines going. So you should have that available. I don't necessarily like prescription medicines, but for those of you who suffer, you have to have that as an option, especially if you're traveling. You always want to get on a over-the-counter regime of what you can rely on. That would be Tylenol, Advil. It's always helpful. You can always get it anywhere, at least if you know it works. And then I think that you should always, my personal is going through turmeric and magnesium. These two have worked perfect for me, but in the last 10 to 20 years, I'm at a place where I can control my flare-ups. I can push a little bit, well, not a little bit, I can push a lot as far as activity, so I keep this trigger at bay. In fact, I try to beat it down so I can actually get this disease process under control. I also like to apply topical. I've done a video on topical application. I love helichrysum, and this is a new one I learned from a patient of mine, spray on magnesium. In fact, we were at our summit at Glacier National Park at Ptarmigan Tunnel, about 7,000 feet. And when we got up there, my calves were pretty cooked. So I got this out. I got my compression sleeves for my calves. And as soon as I did that, I always carry a backpack with a big medical insignia. I had two other people, strangers, come up to me and say, hey, can you mind if we use that too? And they had knee pain. They were older guys. I said, why not? Let's try it. So in that short time period, I hope that they were able to find the same benefits and they can add it to their first aid kits if their doctor's empowering them enough. So that's the idea, is that sometimes when you have a chronic disease process, the positives that you get, the successes you get are so subtle that you'll forget to write them down. So I think journaling is always important, especially if you have a lifelong of pain. a lifelong time of pain, you might just forget, oh, that guy helped, this person did, the acupuncturist helped. So if you kind of know what years you flared up, which months you flared up, which activities flared you up, and you start to accumulate these positives for success on how to flare them down, then you'll have a whole list of your first aid kit. First aid kit can be intellectual, you know what to do, know how to quiet things down fast, or first aid kits can be manual and physical, or first aid kits can be medicinal. It doesn't matter, as long as you know what your disease process is, then you know what to cool down with when you have that trigger flare up, and everybody will flare up. So the bottom line is that if you know your disease process, if your doctor is nice enough to rule out all the other bad things, and you now have a diagnosis of something that doesn't have a cure, like fibromyalgia, then at least you can on your own empower yourself to try to lead a pretty basic life, or at least a well-balanced life. Remember, you always have a chore that you have to push with regards to activity, nutrition, and social interaction. So that's your goal, is to always get to that 80 years of age to 90 years of age mark with all those things accomplished. And the only way to do that is to know what you're going to flare up with. And the only way to take care of that flare up is to know your first aid kits. So hopefully this helps. If you have any friends that are fibromyalgia sufferers, please give this a thumbs up and pass it on to them. Otherwise, subscribe to me for weekly words of wisdom.